Hello, my name is Lillian Wood, and this is my psychology project for Psych 150. This is all about Joseph Wolpe, his life, and his psychology-related achievements involving his greatest discovery, systematic desensitization. Starting off, he was born on April 20th, 1915 in Johannesburg, South Africa, and was the eldest of 4 children. Through the entirety of his childhood, he was an avid reader, and since his parents valued intellectual achievement, in 1933, Wolpe continued his education, making his way to a 6-year-long university education at the University of Witwatersrand. Joseph Wolpe did not take any psychology courses through the entirety of his college career, but it is highly speculated that he was very much encouraged to enter the world of psychology after reading Bertrand Russell's Inquiry into Meaning and Truth. Fresh out of college, World War II was on the rise, so in order to help and counteract this, Joseph Wolpe served as a doctor of sorts treating war neurosis using a combination of psychoanalysis techniques and different psychiatric medicines. This was most likely one of his biggest driving forces into entering the psychology career and furthering his use of different psychology treatments in both patients and just research. Education continued. He did an experiment with cats where he would expose cats to electric shocks whenever they would eat a meal. After this, eventually they would not eat a meal in the room that they were shocked in, so he would take them to a different room to allow them to eat, and slowly disguise that room to look more and more like the room that they were shocked in until they were comfortable eating in that room again. This was a very gradual process that led to discovering systematic desensitization. After this, Joseph Wolpe went to continue his education at the University of Witwatersrand in 1948 to get his master's degree. This led him to eventually run his own psychiatric practice where he could treat his own patients and further his own research. This eventually led to his most famous method of therapy, systematic desensitization. Systematic desensitization was a type of therapy to help his patients manage and acclimate themselves to dealing with situations that generate a disproportionate amount of anxiety to what is actually reasonable, basically addressing and conquering irrational fears. When it comes to understanding systematic desensitization, there are 4 main components that make up how it works in order for it to be good in practice. The first part to consider is SUDS, or SUDs. This is an acronym that stands for Subjective Units of Discomfort. This is what is used when a patient is trying to convey their level of anxiety or distress. 0 represents absolutely no anxiety at all, while 100 represents the worst anxiety the patient has ever felt. Using this kind of scale helped psychiatrists and therapists understand where their patients was coming from so they could start more slowly and build up. Second off, there was the competing response. This is where a client was taught a method to counteract that anxiety. It was normally a form of meditation or relaxation, whether breathing slowly, counting to 10, or different therapeutic strategies like counting with your fingers. This is just the basic step in order to get patients calmed down so they can further go into the next step. This is the hierarchy construction, the basis for the therapeutic treatment. This is where the client and the psychiatrist get together and construct a list of the things that stress out the patient the most. From any sort of events to objects, they could list it in an order from top to bottom what stressed them out the most so that they could address it from the bottom up, eliminating any extra stress and working on it gradually. This also helped break down fears and identify the roots of the problems so they could break it down even further to make it more manageable.
Jimmy Hewitt, please report to the office. Jimmy Hewitt, please report to the office.
The last step of desensitization was desensitization proper. This involved the continuous recalling of stressful events in the order of hierarchy previously listed in regular increments as to not overload the patients. The patient would be exposed to this or mindset and imagine in their head represent the number of SUD, these subjective units of discomfort they were feeling or it increased by, and then they would go back into step 2 and take a moment to relax. This was a very useful method for getting them involved and exposed to this irrational fear of theirs so they could conquer that and eventually not feel that sort of fear anymore. Overall, Joseph Wolpe was an incredibly smart man who invented multiple therapeutic strategies as well as many other forms for combating PTSD. However, his biggest accomplishment was this systematic desensitization, and still today, people are researching this and going off of this to further different treatments. Joseph Wolpe was an incredible man. Here is my cited sources. I hope you enjoyed my presentation. Thanks for listening, and have a wonderful day.